Hey guys, welcome back to Simplified by Jinal Shah. As you can see, today we are going to be covering the remedy Gelsemium. Now, Gelsemium is a very common remedy and it gets asked especially multiple times in compare and contrast with Argentum nitricum. Um if you've been following me, you know I do all the remedies with very few words. The word for this remedy is post flu paralysis. यानी कि हम ये दो वर्ड से या ये एक वर्ड से पूरा रेमेडी का की नोट्स निकालेंगे. अनदर फ्यू की नोट्स दैट यू नीड टू रिमेंबर फॉर दिस रेमेडी इज डलनेस, डिजीनेस, drowsiness, and last is trembling. So these are the five words that if you remember these five words, your remedy is done. And trust me, you are in for the next 10 minutes. सबसे पहले हम कॉन्सेंट्रेट करेंगे ऑन द वर्ड पोस्ट फ्लू. यानी कि दिस पर्सन हैज़ हैड अ फ्लू अटैक रिसेंटली. मोस्ट कॉमन सिम्टम्स ऑफ फ्लू वुड बी रिलेटेड टू थ्रोट, राइट? तो यहाँ पे भी हम पहले थ्रोट के बारे में बात करेंगे. थ्रोट सिम्टम्स मोस्ट कॉमन इज फीलिंग of lump in the throat, cannot be swallowed. ये एक important word है, cannot be swallowed. So the person constantly feels that there is some lump in the throat which cannot be swallowed. गले में कुछ अटक गया है जो swallow करने को difficult हो रहा है. Now I will consider this thing as a guiding symptom for another two symptoms. Because the lump cannot be swallowed, will I be able to swallow food or water? No. So food and water will regurgitate at every attempt to swallow. यानी आप समझ रहे हो कि उसको जो muscles है for swallowing are hampered here. So there is a lump in the throat which cannot be swallowed. Food and water is also regurgitating. And if you are trying to eat anything, it is going to regurgitate. Now, this you might say is a common symptom because if there is paralysis, this is bound to happen. So, let us add a layer to it, difficulty in swallowing food, but especially warm food. So, this is the layer to it. If the food is warm, it is even more difficult to swallow. Otherwise, also food and water regurgitate. Now, let's consider what pathology could be. Because there's most likely a paralysis, uh, the symptom or the disease mentioned in books is post-diphtheric paralysis, but obviously we could use it for other illnesses as well where symptoms match. So post-diphtheric paralysis for the throat. Now another common symptom which comes with flu is itching, right? So which I would write somewhere here itself near the throat, that is itching and tickling of soft palate. You might say this is like the beginning part and this is the next part. You have soft palate, nose and pharynx. Very common symptom of flu, so you could say this comes first, this comes second. Now another keynote that you could tell me is from here. Will this person be thirsty or thirstless? The answer is thirstless. Because there is so much difficulty swallowing, so it's easy to remember that this remedy is thirstless. Okay, so food and water regurgitates, the person is also thirstless. Now talking about tongue, let me just draw it quickly. Now one symptom of tongue that would be present is trembling. The tongue would be trembling. There is thick coating, thick coated, and it's yellow in color. Also tells the fact that it is thirstless, so the person hadn't drunk enough water. This thick coating could also be because of dehydration. Now since we are somewhere in the RS, let's go a bit forward and post throat आता है epiglottis. कॉमन सेंस लगाना, पैरालिसिस है, एपिग्लॉटिस है, तो एपिग्लॉटिस पैरालिसिस हो सकता है। फिर हमारा आता है वोकल कॉर्ड्स। वोकल कॉर्ड अगर पैरालिसिस हुआ तो सिम्टम आएगा एफोनिया। गो इवन फर्दर, ब्रीदिंग डिफ़िकल्टी आएगा अगर रेस्पिरेटरी मसल पैरालिसिस हो गया। So we go to respiratory muscles. The paralysis of respiratory muscles would cause slowness of breathing. So I would just write the symptoms here: slow breathing, oppressed breathing, right? Uh, then we could also say there could be cough, because respiratory system है, cough का element डालना पड़ेगा. So the cough is dry cough with sore chest. Now let us dive deep into this part. Because the person is not able to expectorate because the respiratory muscles are weak, there is sore chest because there's more efforts, but the cough is dry, right? So dry cough, weak respiratory muscles, difficulty expectorating, leading to soreness in the chest area. This is your RS system. You start with, now the main first part of RS would be nose. So nose, here we have fluent coryza. There's a lot of coryza, there's itching, there's problem with throat, there's problem with epiglottis, vocal cord and respiratory muscles, and ultimately dry cough. So this is your main part, which is the RS system. Now let us go ahead with in general musculoskeletal system. Now again, as much as we've done from these few words, we understand there's going to be paralysis, right? So there is complete relaxation of the musculoskeletal system. And there's one peculiar line that you all need to remember, is that muscles refuse to obey the will. They won't work. If you tell to walk, it won't walk. So muscles refuse to obey the will. There is lack of coordination. There's no coordination between muscles, and there is lack of, the muscles or the person is really confused as in what is happening. So there's two C's that you have to remember: coordination and confusion. Now let us see ahead for the eyelids. Eyelids are also again muscles. So any guesses for the eyelid symptoms? Again, because there's paralysis, there's going to be heaviness, and it's going to be difficult to keep the eyes open. So cannot keep eyes open. These are the eyelid symptoms. Now that we've covered the main symptoms, let us go to some systems, right? We have your excretory system, or I would mainly concentrate on urine, and second, I would mainly concentrate on stools. Again, pretty easy. If you imagine there is paralysis somewhere, let us first start with stools. There is paralysis. So in opium, we will see there's a lot of constipation. But in gelsemium with paralysis, you will see diarrhea. Now the diarrhea might not actually be due to paralysis. Books mention it as nervous diarrhea. So it's here where you compare it with argentum nitricum because of the nervous diarrhea. Similarly, if you're going to talk about paralysis and stools, let's say in opium, there is constipation. So that's a differentiating factors. The quality of diarrhea is that it is involuntary but painless, and they have been described as cream colored, right? Now similarly for urinary system, now excretion of urine through bladder is not a skeletal muscle, it's a smooth muscle, but we could still consider it. The urine flow is trembling, it's intermittent. Uh, it could be clear, watery, profuse, so all those adjectives describing that there's a lot of urine but the flow is intermittent, or important factor, since it, again we are talking about paralysis, or there could be retention of urine. So there could be either too much flow or there could be too little flow. These are the two urinary symptoms. Now here comes my favorite symptom, which is related to urinary system in Gelsemium. That is, I'll write it here somewhere, headache is better with urination. Now, this is a keynote symptom, and I've actually seen this in patients as well, that if they have headache, they feel slightly better post urination. This is one important symptom of Gelsemium, right? So, we've done urine, we've done stools, we've done the keynote symptom that headache is better with urination. Now, you might remember Gelsemium is remedy which we also compare it with Naja and cactus because there are some heart symptoms when it comes to Gelsemium, right? So I'll quickly draw a heart here. So, now Gelsemium in general is slightly restless remedy. You have to keep this in mind and then think about the heart symptom. The heart symptom is that fears that unless on move, the heart will cease beating. So unless on move, heart will cease to beat. This is exactly opposite to digitalis, where the person feels that if she moves, the heart will stop beating. So, again, this is a very important symptom and slightly confusing because people confuse it with digitalis. Here it is, unless on move, the heart will stop beating. So I'm drawing a figure where it's constantly moving. And we are almost done with the remedy except the last part, which is that there is chill along the spine because this is also fever remedy. I'd like to draw it here. This is the spine. The person feels chill along the spine running up and down. Again, this is an important keynote symptom. Now, if you see, I've only covered keynote symptoms. I've not gone into detail a lot, but I've covered a lot of important keynote symptoms. Chill along the spine, running up and down the back in rapid wave-like succession from sacrum to occiput. So, we would just draw it diagrammatically. This is the spine, it's going up and down and in a wave form. This is your spine symptom, and there we go. Our Gelsemium is done. Let us just quickly revise Gelsemium. We started with the first fact that it is a post-flu paralysis, and there are four keynote symptoms, that is dullness, dizziness, drowsiness, and trembling. Post flu, let us talk about flu symptoms. We start with nose, there's flu and coryza. We go to throat, there is itching of soft palate. In case if the flu progresses or there is post diphtheria, there's going to be post diphtheric paralysis. If there's paralysis, there's going to be regurgitation of food and water. There's difficulties swallowing food, especially warm food. The person is thirstless. Thirstless indicates there's going to be thick coating. The person has difficulty in swallowing. There's feeling of a lump which cannot be swallowed. We go down, epiglottis is paralyzed. We go down, vocal cords paralyzed. There's aphonia. We go down, respiratory muscles are paralyzed. There's slow oppressed breathing, dry cough with sore throat. We come to this side, there is paralysis of complete musculoskeletal system. The muscles fail to obey the will, there is lack of coordination, and there is confusion. There is heaviness of lids. Urine and stool we've already covered. There's heart, the person has to constantly move or he thinks the heart will stop breathing. Headache better by urination, and chills up and down the spine in wave-like motion. This is Gelsemium for you all. I hope you all have had a good time for the last 15 minutes trying to remember this drug. And if you've liked the remedy, please hit the like button, share it with your friends, and I will make sure that I give up or come up with good content. Thank you.